because I want to be cognizant of everybody's time. So again, I'm Larry Boris. I'm the Executive Director of the National Association of Worksite Health Centers. And I'll be your host and facilitator for today. The agenda essentially is I'm going to have everyone just introduce yourself and your organization and your role. And then we're going to take about 10, 15 minutes and go through the overall topic. And today's topic is selecting a health center manager. And then we're going to have everyone comment on their own experiences, information, recommendations, how you've gone about it, or challenges, or landmines, or issues, things that you'd like to share with the group. We will be recording this for people's later use and to share with others. But feel free to open up. If anybody is uncomfortable with me recording anything, please let me know and we won't record. If you want this to be very much a confidential, and you want to share specifics about individual players, we won't record any of that, or we'll make sure that's deleted. So let's just go around the table as they start. So Diane, why don't you start with yourself, please? Diana?
Sure, Larry. Diana Morrison. I represent NOWIC, and I'm sure you've seen me or heard or even gotten emails from me, but I help Larry with membership and events and all sorts of NOWIC related issues. So yeah, I'm excited to be here and excited to hear what everyone has to say about this topic.
Great. And Diana is located down in Dallas. Amy, again, I'm sorry. Now that everybody's on board, just introduce yourself, your title, your organization.
My name's Amy Heimbach, and I work with Optimal Health Initiatives, specifically within the SIOTA Health Plan. We're located in Portsmouth, Ohio, and I help to run that division. And we have a couple on-site health centers.
Great, thank you very much. Tony, I see you've joined us. Would you introduce yourself and your organization, please?
Hi, Tony Nisi. I am the Chief Medical Officer for On-Site Care, which is located in Utah, and glad to be here.
Great, thank you. Bo, would you introduce yourself, please?
Sure, a pleasure to be on the call. My name is Bo Evans. I work with Pfizer Pharmaceutical. I'm a director of employers, so we work with self-insured employers throughout the U.S. And I also have some experience from our on-site clinics that Pfizer has as well. So thank you very much.
Great, thanks so much. Jason, would you introduce yourself and your team that's with you there, I see?
Yes, hello everyone. Jason Gauvin. I'm Director of Operations with 360 Medical Consulting. We are here in New York City. The team here joining me at the roundtable. We provide on-site health care and wellness services to corporations within the New York City market right now, and Hartford.
Great, thank you very much.
Joe
Courtney?
and Nancy are both here with me.
I'm sorry,
Hey,
who else is with you then?
Joe Brillantino, Assistant Director of Operations with 360. We're members as well.
Sure.
And I'm Nancy Shaw. I'm the COO of 360 Medical Consulting.
Okay, thank you very much. Julie, would you introduce yourself and your organization, please? Take yourself off mute. Okay, Kara.
Me to do that, Larry.
Yeah, please, if you would.
Sorry, I came in halfway through that. My apologies, having a little technical difficulties here. I'm Melanie Small. I am the Director of Intermed's Worksite Health Program located in Maine.
Great, thank you. Kara, would you introduce yourself, please?
Good morning. This is Kara Peterson. I am the VP of Business Strategy with Neopath Health. Work with the organization to operate and manage on-site clinics. We're primarily in Minnesota and Wisconsin, and been doing this since 2008, but are small just in this regional area.
Great, thank you. Robin, would you introduce yourself, please?
Hi, my name is Robin Elkins, and I am with Ohio Health Employer Solutions in Central Ohio. Just jumping on and wanting to hear more about the information and topic you guys have to present today. So
great, thank you very much.
Thank you.
Courtney, would you introduce yourself, please, Courtney?
Hi, I'm Dr. Courtney Young. I'm a senior medical director at Quad Med. The company itself is located in Wisconsin, and we're in numerous states and have a telehealth option, virtual care called Quad Med Everywhere in all 50 states.
Great, thank you very much. Stephanie, would you introduce yourself, please?
Hi, I'm Stephanie Kennedy, and I work with Larry and Diana at NOWIC.
Great, thank you. Tony, introduce yourself, please.
Hi, I'm Tony Ginner. I work with Robin with Ohio Health here in Ohio. We're an employer. We work with employers, provide injury care and services, employment services to employers here in Ohio. And I manage a couple of on-site clinics where we have an Ohio Health nurse working at a local employer to provide healthcare services.
Thank you. And finally, Lisa, would you introduce yourself, please? Lisa Corrales, can you hear us? Okay. Well, we'll get started. And again, as I said, the format here is I'm going to present some information about this topic for about 10-15 minutes, and then we're going to go around the table, and I would ask everyone to please submit your own experiences and information. That's what a roundtable is all about. That's what the value of networking is, the sharing and learning, whether things have gone good or gone bad, to help people learn and build upon those experiences. So the information that I'm going to, okay, sorry, Lisa, we'll work with you on that. As I said, this is all recorded, so you'll have it later on. So the information I'm going to provide today is from a book that we produced last year with Class Research, which is an organization out of Salt Lake City that evaluates health benefit vendors in a variety of topics. And this very short document called Purchasing Guide for Selecting an On-Site or Near-Site Center Manager. It's only about 5 pages. It's free to all of our members. And so what I'm going to be talking about is really the guts of this, the highlights. And if you want copies of it, members can just go on our website and download it, or if you can't find it, let me know and I'll send it out to you. So, when we start out is you've got to decide what your options are. And it doesn't matter whether you're a small employer or a large city or state or large manufacturer, rural or urban, you have choices. And it's important that employers talk to their benefit advisors, brokers, consultants, but also other employers. And you have to do a real self-evaluation. And for those vendor partners and health providers that support employers on the phone, I would also suggest that these are things that you need to help work through your employer partners or clients and prospects, because employers have essentially 3 options to move on, and there's some hybrid in these as well. The first is, of course, managing the center itself. Some employers are very paternalistic or just decide they think they can do things better. They're used to doing their own benefits. They're, of course, self-insured. They may manage their own networks. They may run their own programs. They may actually administer their own claims. And so there's a certain belief that they know their culture, that they know their population, and they've got a strategic vision. And so some employers want to manage it themselves. And I would say, based on our research, about 18 to 20% of employers manage their own centers. They hire the staff, they build a facility or renovate a facility, they review the performance, and et cetera. Probably about 2/3, though, outsource it. And they can outsource it to either a third-party service provider who specializes in employer centers, or they can outsource it to a health system, health provider, medical group, et cetera. So a lot of this really does depend on the employer's relationship with its workforce. For example, in some union situations, there's just not a lot of trust between the employer and its workforce. And so it's important that the employer offer kind of a hands length, arm's length solution. In many cases, that means it's not named after the employer, so it's not Acme's Metal Worksite Center. It may be Mary's St. Hospital's Worksite Center, or you may have a different brand altogether, like Life Cycle or Lifespan Health Center. So it's really important to understand your relationship. And a lot of ways to do that is clearly to have focus groups or surveys to find out, if you build it, will people come? Will they take advantage of it? You also have to determine whether it's really important, because depending on this, it can be the most treasured benefit that you offer, because it would, many times an employer's relationship is very strong with employees. And the big two barriers in offering a center are often trust and confidentiality. Do people feel that their personal data will be safe, or will it be shared? Many employers, particularly manufacturers, started off with an OC Health clinic. And so the company doc or company nurse would see someone, and then under state law, they're allowed to provide information about that person's condition and their potential to return to work back to that person's employer, their supervisor, their manager. And so if you end up shifting from an OC Health center to a primary care center, the concerns that employees and others might have about sharing information is really upfront. And so if in fact you started with an OC Health center, or you have some poor relationship with employees, it may make sense to either educate them about the difference in the new center and the new providers, and that the law for personal care says that no individual information can be shared with the employer. You have to educate people about that. But sometimes it makes sense to use local providers or outside people that they're not familiar with because of that trust and confidentiality. So let's walk through the three major pros and cons of each of the areas. So for self-manager, again, an employer would have complete control over their program, their data, the staffing, and the management. And many employers, of course, start out with a medical health plan, and then they have a PBM or a pharmacy plan. They may have a wellness vendor. They may have an EAP. They may have a disease management vendor. They may have a cancer navigator. And so they've got a variety of organizations out there that they're individually contracting with that may or may not be feeding data into a single source, and these vendors may or may not be talking to each other. Well, some employers have got a very firm relationship. They have vendor summits, they bring them together, and they have all that information in a central location. Many times it's controlled or it's run or managed by their benefit advisor, so that they have someone who's constantly looking at that. So that approach, the ability to control your data, to see everything, to understand the cost, understand the time, is often preferred by those employers who really like managing the benefits. The other side of the fence clearly is it's seldom a core service that an employer has. It's often difficult with limited resources. You have limited space and expertise in running a medical practice. Particularly as healthcare has evolved to more what I call the click and mortar strategy, where you've got to deal with hybrid populations, and you really want to be able to offer both in-person care at the worksite and then virtual care for those who can't come to the worksite or who aren't working there. There's also potential liability issues. You've got to provide for malpractice insurance and other issues. And again, the issue of trust and confidentiality. However, again, I would tell you, among this 18 to 20% of employers who go self-management, there are some very large employers, jumbo employers, who are doing this, excuse me, as well as mid-size and small. So it's not so much the size, it depends on the strategy, the culture, and the desire of the employer to control this. The second group I'd talk to would be community health providers. So these are health systems, these are hospitals, medical groups. Sometimes it's just one or two major providers. The real pros of using a local community provider is clearly they have easy access to clinical staff. They can use their current system. They know the resources. They work with personnel agencies all the time. One of the big issues in the success of centers is the continuity of providers. If in fact you can make sure people see the same provider all the time, then there's more of that relationship that can be developed. If there's a constant change in providers, people have less loyalty and less interest and don't really have that kind of relationship. But when a provider leaves and you need to fill that spot, ideally you fill it fairly quickly and with someone that people, again, would be comfortable with. So many times a health system, health provider, medical group have the staffing to do that. Often there's a lot of flexibility in their staffing. They can add other kinds of resources that are within the medical community, within the healthcare system. They can tie into that as the employer needs that, or individual patients may need that. Oftentimes they're built primarily on fee-for-service, but they're willing to work on a contracted basis or on a capitated basis as well. And then again, back to confidentiality and trust. A local healthcare provider perhaps is the best kind of partner in that people already know them. Perhaps their own personal doctor is in the system. They know the brand. They know St. Mary's Hospital. They had their child there. They've gone there before. And so you don't have to worry about that big barrier of people saying, well, who is this? Why are they offering care? What's their reputation? Again, on the other side, hospitals don't have a lot of experience typically working under an employer's setting, understanding employer benefits, being able to complete an RFI or RFP, be able to submitting performance reports, customizing their services. Oftentimes there's a conflict between the employer's objectives of reducing the number of specialty referrals, reducing the number of unnecessary care or low value care, making sure you don't have people leaving work for tests, for lab exams, for other kinds of things that impact productivity. And so if the hospital is unwilling to change and to understand what the employer's needs and strategies are, there's not going to be a good partnership there. The other issue is they may not be able or comfortable in working under a per member per month or per employee per year approach. And one other item is many employers have multiple locations, and an employer likes to have consistency, prefers not to have multiple providers doing it. They'd like to have a single source. And if a health system cannot address more than one location, then an employer is going to have to find another partner. And that is often very challenging to try to mix and compare those. So those are some of the key issues that we've learned. For a third-party service provider, there's probably 60 of these organizations around the country that we've identified. There are those that are very, very large, that have over 800 centers and cover 11 million lives. And then there's some that are just focused on a regional area or a small geographic area. Well, the pros are these companies are solely created to serve employer benefits, to serve a population. They know the staffing that are needed. They know the management. It's really a turnkey operation that they can bring. They can share and show other employers that whether in the same community or the same industry or the same size that they've already been successful at. There's much more experience and confidence in a group like this that has worked with employer benefits, knows the complexity of dealing with different kinds of claims and approaches, and really is focusing on bringing it all together. Typically, they can cover both a regional and a national view. They can provide a variety of contract models. Typically, it's not fee-for-service. It's usually a per member per month capitated. It could be a cost-sharing basis. Could be a risk-sharing basis. And there's a broad menu. They can constantly bring in new types of services, both virtual and in person, specialty services, lab, everything you'd want. So when you're looking at a third-party service provider, clearly you're looking for one that brings a lot of experience that you can go to. Again, the other side of the fence, people don't know these. They don't know a certain Joe's healthcare system or approach. They may not be familiar with it. They may wonder, who are these people? Where they come from? Some of these organizations who are smaller have a difficult time filling open spots when a provider leaves. And that could cause the center not to be open for a certain length of time. So you really want to understand the ability of these centers to continue to fill the spots as needed. There's also for the potential of the vendor being acquired, just like in any other business or even the health systems, where you have certain vendors who are acquiring others in the field because they offer other kinds of services or they serve a different marketplace. Maybe it's unions, maybe it's public health sources, maybe it's smaller employers. And some, like the health systems, do have geographic limitations. They're focused just on a single state, for example. So these are some of the areas that you might want to consider and look at. So when you're making a decision, you've got to be familiar as an employer with the different options you have, even when working with a consultant. So the first thing I'd recommend to employers, as well as providers who want to help learn about this area, is find a benefit advisor, find a consultant who really knows this information, who knows this field. Too many brokers, especially smaller brokers, all they know is submitting premium comparisons, or they know the top 3 or 4 worksite center vendors. They don't really understand the field. They don't understand the market. So you want to find a benefit advisor who's got knowledge of the breadth of different types of players in the marketplace, is also familiar with the health systems, and can match an employer with the management model that fits their culture, their objectives, and of course, their budget. And as I said, you want someone who knows who all the players are, because there's lots of options in any kind of marketplace. The other key part, if you want to visit other employer centers to see what they're like, see how a hospital runs a certain center, see how a service provider runs a center, find an employer's center, find one that matches your needs or is currently managed by an organization you're considering, and see how they operate, see what the interaction is, see what the employer's feedback is, and that of the patients. You want to ask about long-term viability. This is a partner. Someone who manages your center is not a vendor out there, like your disease management or your lab or your telehealth. These are people who essentially are part of your organization. Many employees view them as staff. They view them as part. It's really a very close partnership, much more so than the other point solutions that employers have typically done. You want to find out about the technology that they have, and particularly nowadays, data security issues as well. You want to understand how they approach technology. How easy can they expand? Can they consolidate all the data into their EMR, electronic medical record system? And do they have the ability to bring in medical claims and pharmacy claims as well as others? So the other things, you want to determine the right location. You want to be on site, near site, or a shared center. Again, all the potential partners, many of them focus on just the on-site, but some can do a near site and some can do shared. Some can also offer a virtual only center, or can tie in a hybrid virtual as well as an on-site. You want to find out how far people live. A geo-access study is really something you want to do. You want to look about virtual and in-person. You want to determine if you need a mobile unit, perhaps. There's some vendors who can offer that, some hospitals that can, and some that can't. You want to look about their ability to get health staff and licensure requirements. What can be done? You want to determine where you're located. Can people, particularly dependents, come in and be there where it's safe and confidential and secure? You don't want to have a center in the middle of the factory floor. So how can a vendor approach these? So doing the geo-access, make sure your vendor understands who's in your population and where they're at. They should be offering ideas on how to go about doing this. They should be telling you how you can determine the interest of the workers and dependents to utilize the center, the kind of services they want. But at the beginning, you also want to plan with growth in mind. You don't want to start out with a facility or a location that's very small and end up having a great demand for more services. So your vendor partner or health system partner really needs to be able to plan with you on growth and tell you what the potential is and how you may have to meet there, and what kinds of services you should start out with and what you shouldn't. We've unfortunately seen a number of centers where the employer wanted all kinds of services and the vendor partner just went along with them, and they end up having providers sitting around most of the day because they weren't getting the kind of utilization. You clearly don't want to spend a lot of money on providers or on fees if they're not going to be fully utilized. Then again, you don't want to underestimate it. I can't tell you the number of people who have brought in, say, a single social worker or a chiropractor, and all of a sudden their schedule's filled within the first week. So you want to be able to work with this partner to know the approach to take. So the vendor, a health system provider, needs to, again, align with your culture. So regardless of who you use, they need to understand the workplace. They need to understand the physical and mental tasks. They need to take the time to understand your culture. They need to know what you're good with. For example, one of our Silicon Valley members, they interviewed providers that a vendor had suggested, and they told them, look, you're going to have to wear t-shirt, shorts, and roller skates because our population's in the ball field or rolling around, and that's where we get some of our injuries. And not all providers are comfortable going outside of the four walls of the center. So whoever you're working with has to be able to identify and bring you the right kind of providers. And of course, you want to get multiple references, and you want to be picky. You want to find those that meet your industry and your size, et cetera. So just to kind of sum up you want to clearly define how the vendor understands performance. You want to understand how they evaluate it. Will they be able to provide you reports and data on what we call a value of investment approach? Do they look beyond just cost savings, but also satisfaction, productivity, reducing absenteeism, reducing the need to use a hospital emergency room, keeping people on the job and back? Can they provide the reports with the data you would need? And make sure they have attorneys, and you bring an attorney so that the contract is covering all the aspects of this, both before and potentially if you're going to have a transition down the road. Most of these contracts are 2 to 3 years. And you want to learn if they have experience with health savings accounts. As you probably all know, under the IRS code, if you have people who are under health savings accounts plans, they must pay a mandatory copay to use any on-site center services beyond first aid and triage, which is called the fair market value fee. So you want to work with your partner, work with your attorneys and benefit consultants to come up with the correct kind of fee that matches your needs. And lastly, the lessons learned our members have told us is do an RFI with a potential partners before you do an RFP. Find out if those who want to bid on your contract are willing to meet your requirements, your performance issues, your strategy, and all the types of services you're looking for. Can they integrate all the data from all your vendors and benefit programs? Can they provide you with all the reports you need? And alternatively, as a health provider or service vendor, you want to make sure the employer provides you with claims data, medical data, pharmacy data. You have to understand what the population and their needs are. Also, you want to have some kind of portal. You want to be able to help people navigate through the system. But if you have worked with someone like Castlight or some others where there's a patient advocate, you want to make sure that the worksite center is always listed first as the most accessible, lower cost, best quality for primary care services. And lastly, you want to make sure that the provider, whoever you're working with, your partner, is communicating to patients that they should inform their personal doctors, if they have them, to utilize the center, share information, et cetera. So with that, I covered a lot of information. Copies of this will be available to everybody on the call. But I'd like to now go around the table and get your perspectives and thoughts on these different topics. So I'm only going to call out names based on how you show up on my list, no in particular order. So I'll start with you, Amy Heimbach. Why don't you give us your perspectives and experiences in this challenging area?
Wow, wasn't ready for that. Kind of new to this whole thing, so learning, seriously, learning as we're like going through this process. Really don't know what to offer right now. So I'm here just to try to learn and better understand.
Well, let me ask you,
the
Amy,
whole
from your
process.
perspective as someone who is also trying to get employers, what are they asking for? What do you think?
Can you ask that again?
Sure. You offer centers for other area employers, right?
We're a self-funded health plan who has on-site health centers.
Okay. So do employers come to you who are not members of the plan, or do they have to be members of the plan to take advantage?
They have to be members of the plan.
I got you. Okay. All right. Thanks very much. Tony, what's your perspective on this from the medical director's side and a service provider side?
Thank you.
You're on mute. There we go.
Well, yeah, you can hear me okay?
Yeah, that's good.
So just as background, Onsite Care is a small third-party vendor. We fit into that bucket of a company that works exclusively with employers to provide on-site, in some cases near-site care. We have about 26 health care centers around the country, most in Utah, but several other states as well. And just as I was listening to the presentation, Larry, the options that employers have for managing healthcare with their employee population made me think of a couple of examples of where on-site care has where employers have sort of gravitated into the direction of working with a company like On-Site Care. So, about 10 years ago or so, we assumed operations of a steel manufacturing plant that was running its own clinic. And I wasn't involved in that at the time. I wasn't with On-Site Care until about 8 years ago. But I think the experience there was sort of the complexity of healthcare, regulatory environment, things like that caused that employer to stop and think about, whether they could better insulate themselves from those sorts of things that they're not expert in, frankly, and very few non-healthcare employers are. We also took over a clinic from with a business that had it set up with a large local healthcare organization, the type of healthcare organization that has a ton of local resources. And I think the clinic was okay, but they were underwhelmed with the performance of the clinic. And I think part of that had to do with the fact that a large complex healthcare organization that's not in the business of providing employer-sponsored healthcare either doesn't have all the tools in their toolbox to deal with that, or just doesn't have the bandwidth to deal with a very small fragment of their business. So, these are a couple of on-site care success stories that I think illustrate, what we have to offer as a third-party vendor. I'm sure there are stories that go the other way. But that's just an FYI.
Great. Thank you very much. Jason, from 360, give us your thoughts or your experiences in this area.
Sure, thanks. I think as we were listening to the presentation, my main thought on this was, obviously the presentation is driven towards employers trying to make the decision to go with a vendor, or how they'll have it managed with an on-site or near-site. And I thought, interestingly enough, we're in a space where looking for new business is important, also maintaining current business and continuing to show value, whether that's through emphasizing the care that the patients receive on site, whether it's their experience, as well as the outcome of the care and services received. And all of that plays a role in that satisfaction and showing that return on investment value for that individual. But then for the employer, long terms, it's really ultimately about the cost savings and how does this financially help and make sense for the organization to continue. So I might ask you, Larry, about maintaining or continuing that care, resources available to demonstrate how to continue to emphasize that successful partnership for the future.
So what it is, it's really all about the performance reports. If we have identified, as I said, a variety of reports in probably 7 different performance areas that, again, under the strategy of a value of investment approach to identifying performance, that come out either weekly, monthly, quarterly, semi-annually, et cetera, to demonstrate the value and the performance of the center and the provider who's doing it. So not just avoidable cost. Again, I mentioned non-emergency room, non-life-threatening emergency room visits, how you're impacting that rate, reducing absenteeism, number of people getting flu shots, biometric screenings, the percent of people getting more engaged, reducing the number of risks for high-risk people, keeping diabetics, for example, out of the hospital, out of dialysis, number of people doing wellness services, people staying on their meds and moving to generics. I mean, there's multiple ways that I could share with you, and we have other material. But to prove your worth, you've got to be able to do these performance reports that the employer wants, that meets their expectations in a timely manner. And if you don't have the data or technology to do that, you're just not going to be a benefit provider of choice. Does that help at all?
One follow-up question, if I could, is the relationship so critical to be able to have some of that collaborative data sharing between ourselves as the on-site provider, the employer, and being able to sit down and evaluate that together?
No doubt about it. I unfortunately clearly admit there are employers who don't put out the money for communications and marketing of the center. They don't let their vendor partner have claims data from the pharmacist, the benefit group, or the medical plan. And I think that's part of the contracting and relationship that you need to do early on when you're working with a client, is to say, we'll bring this to the table, but without you also doing these things, we're not going to be successful, or we won't be able to demonstrate our value to you. So again, this is a partnership. This is not one way, as many other relationships are between employers and vendors. But again, there's got to be discussion early on, during the discussions, during the RFP process, and in the contracting and implementation. And you want to have key players and have to have them dedicated. Sometimes the C-suite has not been included enough and hasn't made a financial commitment, but that's why a financial officer or CFO really needs to be part of that. Yeah, go ahead.
Thank you.
Yeah, Larry, thank you for the presentation. That was great. It really hit home. In terms of, you mentioned survey or focus group to kind of see how far employees are willing to travel for MSK or near site primary care. We have a clinic that we opened in Manhattan 2 years ago, and the schedule is pretty saturated. You know, word of mouth obviously helped with that volume, as well as just kind of being more involved with their wellness fairs and such. But I was wondering if anyone, you know, here has used a specific survey or focus group tool to kind of, you know, maybe see and collect that data, right? I mean, we are saturating the schedule where there's talks of potentially getting larger space, but in Manhattan, real estate is obviously very expensive. So, you know, we want to be ready for maybe a pivot to near site. And I was curious as to how maybe some of you have collected some of that data or surveyed.
So I opened it up to the group. I don't have any specific document or tool that's used.
Okay.
Yeah, I mean, we glad to talk about how you can conduct a focus group, or how you could, the kind of questions in a survey. We have samples of that in our database.
Yeah, okay.
Okay. All right, let's move on. Thank you. Julie Gillum, your thoughts or suggestions, experiences?
I was having a hard time unmuting. Hi, I'm Julie Gillum. I work for Optimal Health Initiatives, and it's a self-funded trust of schools. And my division is in Southwest Ohio, and we currently have 3 centers. And we have experienced as you said, Larry, purchasing. So we have we're managed by Care Here. Now we have Premise Health. And then I think probably the thing that I thought was most important on your presentation, Larry, was the technology and, where the company's gonna go and making sure it's aligned with your goals, and then in integration and security, IT, those types of things I think are really important.
Okay, thank you. Kara Peterson, your thoughts and experiences?
Yeah, so again, so our experiences with on-site, near-site, shared sites, we virtual as well. And we're one of the smaller regional groups. I think, what I've heard you, Larry, say really echoes what we find as far as the true partnership being critical in these relationships and building successful clinics. I think the groups of individuals that are looking for a management party to manage and operate their on-sites have shifted it. In the earlier years, it was educating about why the value, and now more and more people have an understanding, but it's trying to differentiate on that partnership. Are you going to be acquired? And that's really where we focus a lot of our conversations, to build those relationships and through the sales process, and educate people on why that is truly important. We bring in different care as we grow those relationships, as far as bringing in behavioral health, physical therapy, chiro, whatever is beneficial for that group. So I think it's just, finding alignment with the culture, just kind of echoing what has been said. I think our experience has been that we know, when a group is looking at something to do the benefit of truly increasing the health and well-being of their employees, that is a true match. When they're very focused on the financial aspect, I think we find that we're not the best partner for them, because we're looking for those long-term relationships. So I I'm enjoying listening, and hope that was helpful.
Great, thank you very much. Lisa Corrales, Lisa, your thoughts and suggestions? Take yourself off mute, Lisa. Okay, Melanie Small, you give us your thoughts?
I think I would just echo, I think what a lot of other people said, that I think is something that isn't always recognized in our field, which is that the partnership and the relationship is most critical to the success. Because if an employer doesn't have the right sort of mindset or philosophy, then it's not going to be successful. So, and we have 3 clinics that we run. We're a small local company. We're one of those companies. We're not a hospital, but we are a physician-owned primary care practice. So we have a lot of already patients established in the community that we see at our on-site clinics as well. So there is a nice overlap there in the work that we do. And I think the other piece that feeds into all of this is the employers recently being able to get access through the recent ACA changes and having access to their data now. They're not really sure what to do with it. So we're spending a lot of time helping them try to figure out how to get the data and then what to make of it once you have it. And this idea of the fiduciary responsibility is sort of, I think, just landing with them as well. So there's just a lot, it feels like, happening all at once in the healthcare industry that's really pushing people more toward the worksite health center models.
Great, thank you. Okay, we've gone around the table once. If anybody has anything, any questions you have about this topic that you'd like to hear from those on the call, please just speak up. You have control of your own microphones, and so I'll be glad to take any questions, or you could put something in the chat box and I'll mention it. I did want, you may have seen Lisa sent out a note to everyone. Her mic's not working, but she did indicate how important it is that employers market the centers. And I got to tell you, I've been in healthcare benefits on the employer side for 45 years, and the employers typically do not spend the time or the resources once something is up and going. Too many of them will promote it during open enrollment and then let it lie. And I think whenever you're working with an employer, or if as an employer, you have got to budget enough so that before, during, and after the center opens, you are in front of people's faces, whether it's refrigerator magnets or something in the restrooms. But, you know, a key thing that I would tell you and that I think has worked well is making sure anybody new who's joined an employer, part of the onboarding process is a visit to the center or information about the center. And then all the health fairs or all the biometric testings or lunch and learns either include someone from the center or are operated at the center. Having senior management come about and use the center and then be visible in talking about it, whether it's on an employer portal or whether it's in a newsletter or whatever. Having testimonials, particularly from senior management, but other workers, is really very powerful in getting people to understand the value of these centers and such. And again, sharing the data. You have to have your vendors bring the data into a central location so that the center providers can really understand where this patient has been seen before, what kind of tests they've had, what kind of results. You don't want to walk in blind. And again, my mantra to everyone on this call is don't let the worksite center be another fragmentation of the healthcare system. It needs to be an extension of the system, whether it's if a person has an individual doctor, that doctor, you should be informed about what's going on. The patient should give a release of information so the doctor can provide their regimens, their prescriptions, their management, so that the worksite center providers can deal with it. You know, as we all know, people see their doctor once or twice a year for 7 to 12 minutes, but they're at the worksite 1,000 to 2,000 hours a year. So there's a great opportunity to help people manage their own care without them having to go back to their primary. And the other interesting thing is our surveys show that 40% or more of people who use worksite centers do not have a personal doctor. So it really does become their medical home. So as a partner, or as an employer, or as someone who's trying to get employer business, you need to promote these kinds of things. Many employers, and I'm guilty of this as well, we used to say to employees, find a personal doctor, get a physical once a year, and that'll take care of your wellness and preventive services, et cetera. And we find people just don't have these relationships. Tony, do you want to say something?
Well, a couple of things you said, Larry, that you know, reminded me of some other experience. So, I mean, one of our failed clinics over the years failed in the context of a company that where the offering a clinic was a favored project of their CEO, but their head of HR wasn't really as much on board with it. Of course, when the CEO tells you to do something, you do it, but you do it with enthusiasm. And then the clinic, you know, was not well marketed, as you alluded to. The other thing that harkens to a point you made in your presentation is that the business did not make it cost competitive, and there were reasons for that had to do with unions. This was a large utility, and so there really wasn't a strong cost benefit to using the clinic, and that's important in the success of these clinics as well. Just a clinical point too, I think from the standpoint of an on-site care provider, and I still work in our clinics, even though on-site care is an independent entity and we're not part of a large, well, I shouldn't say that exactly. We are part of a large healthcare system, but not locally. But it is really important when you're practicing a high level of clinical care to have some connection to the health resources in your community. So I am connected to our two largest healthcare providers in the state of Utah via their medical record system. And we do have a function in our EMR that imports outside data into our EMR. I think that is so critically important to providing effective medical care, regardless of what you're attached to.
Great. Thank you for sharing that. Okay, to close, I'm going to go around the table one more time for any comments or ideas that people have. So in back order, Melanie, I'll start with you.
Great, thanks. Thank you, I guess, would be my closing argument or comment. I appreciate you putting these together, first of all, because I know when they first start off, they can be a little clunky and awkward, but I like that you're doing it because I think that we're all trying to do the same thing and just trying to deliver healthcare to people. So I really appreciate the effort you put behind this, and I liked your presentation.
Thank you very much. Kara Peterson, your thoughts, final questions, anything?
Yeah, I guess I echo Melanie there. I don't have anything further to add. The additional comments were spot on. I think we hit quite a bit in a short bit of time, and this was helpful to hear it from others. Thank you.
Right. Thank you. And, before we conclude, I do want everyone to suggest roundtable topics. Most of the people on the call are from a provider's side rather than the purchaser side. So if there's topics you specifically want to discuss at a roundtable, please send me an email. I'd love to do that. Julie, any last other comments, Julie?
Just getting ready to drop. No, just I
Gotta
was gonna
watch
say
it.
the marketing, the marketing is really important, and we don't have a problem filling our centers. So the marketing, we've marketed with newsletters and also having staff go out into the buildings and do like screenings to try to get them into the center. And then we incent screenings. We have an incentive, and I think that helps too. So
What kind of incentive do you have?
our incentive is just on the screenings themselves,
Hmm.
150 towards the deductible.
Gotcha. Great. Thank you so much.
Thank
Jason,
you.
anybody in your table that have last comments or suggestions or questions?
Sure. Thank you. I actually look forward to networking, connecting with the people on the call. I appreciate their interest and willingness to share their experience. And Larry, did I hear you were on the employer side for 40+ years?
Yeah.
Yeah.
Yeah, I worked for a state medical society for 17 years. Then I ran the Midwest Business Group on Health in Chicago for 26 years before getting involved with NOWIC for the last 12 years. So it's been
Thank
a
you
while.
for your experience and
You're
resources.
welcome. You're welcome. Deborah Follett, and last minute thoughts, comments?
I just really appreciate this, and our clinics are doing really well. We have pushed and reminded people, and I mean, we've had to expand a couple of the clinics already, so I really appreciate hearing other stories.
Great. Thank you very much. And Amy Ambach, last comment.
Yeah, thank you guys for doing this. It's been very insightful and helpful. Look forward to joining more of these calls and
Great.
building relationships with others in this industry. So thank you
Great.
guys.
Thank you. This is all about sharing, and so I appreciate people stepping up and commenting. So everyone have a good week. Be well, stay warm or cool, depending upon where you're at. Take care. Bye-bye.
Bye. Thank you.